Now, as I said in the beginning, Lisa, though, was unable to be here, and I'm going to try to give, she sent her slides, try to give her lecture. She's presenting two different studies they've done at the University of Michigan on women during pregnancy. So this talk is on promoting pelvic floor health during and following childbirth. Those are her disclosures. So we all know that childbirth can affect the pelvic floor and the bladder. And every time I see this slide, I do a Kegel. And that really we need to promote optimal outcomes for mothers and babies, and we need to develop an evidence-based practice. And the PEARL project was promoting effective recovery from labor, and you can see all of her colleagues there on that slide at the University of Michigan School of Nursing and Pelvic Floor Research Group. It was a randomized controlled trial of a bladder health class for pregnant women. You know, we've heard a lot this meeting about classes, community-based education. I think it's kind of exciting that we're moving more and more into that, showing the effectiveness. Intervention was a combined self-management program of pelvic floor muscle training, the NAC, quick pelvic floor muscle contractions is sometimes called the squeeze trick, and bladder training. Women were between 16 and 27 weeks gestation, completed an antepartum group bladder health class. They were followed for 3 years. The aim was the mean incidence of postpartum UI would be lower in women who attended the class as compared to the routine care counterparts, and the severity reduced for those who did have urine leakage. It was randomized, bladder health versus routine care, assessments at 6, 12, 24, 26 months postpartum. Surveys completed. The Antonakis, I'm not aware of that one, leakage index using yes-no item for UI and summary of terms for severity, the Sandvik index for frequency, and the paper towel test. So with the paper towel test is at a comfortable volume of at least 150 cc's. You put a paper towel at the perineum, and you have them stand, and you have that individual cough hard 3 times to see if you leak. That's being used now in many studies. And actually, Janice Miller, one of the co-authors of this research, has described that in the 1990s published literature. So the recruitment was 828 were screened, 313 were excluded, not meeting inclusion criteria, refused consent, and other reasons. 515 were randomized, 257 to the bladder health class, 258 to standard care, 209 attended the class, 64 was excluded from analysis. So the final for analysis was 451. 222 for bladder health class, 229 for standard care. And as you can see by the demographics, the age there is around 30. In race, as far as years of education, and then the annual income. This is what I found interesting. Look at the any leakage, bladder health class, no class, 68% for the bladder health, 64% for the no class. Leakage severity from 0 to 8 was 3.77, 3.63. On the Sandvik, 1.88 of a scale of 0 to 12, 1.7 from 0 to 9. Any leakage at all, and so the paper towel tests, so any leakage, and then they also would measure the wetted area actually of the leakage on the towel. I've been involved in the paper towel tests, and some of these women literally overflow the paper towel, and some it can be just a very small, like dime size. So any leakage on the paper towel, 45% for the bladder health, 38% for no class. And adjusted for UI baseline, the bladder health class had a 24% lower odds of UI incidence postpartum. Leakage severity scores were 18% lower. Adjusted for UI at 35 weeks, bladder health class had a 38% lower odds of UI incidence postpartum to those assigned to standard care. And the severity score was 22% lower in the bladder class. So prenatal bladder health class was helpful in UI frequency and severity. Overall incidence of UI is low in healthy women who experience a healthy pregnancy. Further evaluation of the right timing, right techniques is required. Is there a sweet spot for providing this information, these techniques? You know, I was talking to Lisa about this, and I asked her again, and I always ask people that are in, dealing with pregnancy, well, does anybody ask these women, do they leak when they come in? And again, she says, no, not really, we don't ask. And then I know from obstetrician gynecologists, at that 6-week follow-up, do they ask, what do you think? When this is in the U.S., they're not asked. And we have more and more literature on the fact that education, such as a bladder health class, could be helpful to these women. And these are young women. So let's talk about their next study, which is on the events of normal delivery. The problem of leaking and things falling out. I love her slides, huh? You have to kegel when you see that, especially that first one, right? There's competing hypothesis on the mechanism of injury during vaginal delivery. Is it nerve compression, or is it muscle tear with stretch? So this study was evaluating maternal recovery from labor and delivery, and the main author on this is Janice Miller, who's one of the colleagues. They also have a research center there with James Ashton Miller and John Delancey. I'm sure if you're aware of this literature, they have been well published in this area. The aim of this study was to identify the mechanism of injury post-childbirth to the levator ani muscle. Is it a tear or is it nerve compression? Knowing the mechanism of injury will assist us in knowing when or if to initiate pelvic floor exercises. And I think this is great because you and I know if you practice in this field, you just kind of do the same thing with every woman, and there's some women that get better, and there's some women we probably shouldn't be doing it to, right? But we really don't know who is really the best candidate for what we're doing. Study design, birth-related risk factors, 7 weeks and 8 months. A clinical exam, and they did MRIs on these women. And there's one of the publications here evaluating maternal recovery from labor and delivery, bone and levator ani injury. So you can look this up also, too, to read this research. And this is looking at the MRIs as far as at 6 weeks and 7 months postpartum. The conclusion was that the pubic bone edema and subcortical fracture and levator ani muscle injury are common when studied in women with certain risk factors. The bony abnormalities resolve, but levator tear does not, and is associated with levator weakness and posterior vaginal wall descent. They did not see evidence of muscle wasting consistent with nerve injury based on those MRIs. So the summary is the initiation of pelvic floor exercises to support recovery post-childbirth will not change the presence of a tear. Concern for the need for pelvic floor rest post-childbirth due to nerve injury was not borne out in our study. And there's Lisa's email if you want to write that down, because I'm not sure I'm going to be able to really answer a lot of questions, so we can talk about some of this area if anybody's doing research or working with women in this age group and, of course, undergoing childbirth, and your views or what you've seen with this. So thank you. Any questions?